Hello, my name is Agbemi Elizabeth, and I am very happy to be here to talk to every one of us about this topic. I hope you would learn from this. Thank
We're talking about PCOS, and recently they changed the name. So, can you tell us about PCOS, or let's say, can you tell us about PMOS?
you. Okay.
The word PCOS simply means Polycystic Ovarian Syndrome, and it is now known as PMOS, as the Polyendocrine Metabolic Ovarian Syndrome. You see, this topic, it's very interesting yet very, very educative. I believe many females don't even know they're actually suffering from this syndrome. PCOS can actually occur in anybody. It doesn't have to be age, or I think from the age of 18, as long as you have started seeing your menstrual cycle, or you have started like ovulating, definitely you can have PCOS.
So, what exactly is PCOS, and why do you think many young girls still know very little about it?
I said earlier, PCOS is defined as the polycystic ovarian syndrome. Why do little people, why do we feel like just few people know much about it? The reason is because not everyone likes to study. Even before I was diagnosed of this so-called syndrome, I have heard about it and I have read so much on it. And it was during my course of researching more about PCOS, I got to realize that, oh, does it mean I also have PCOS? Until I actually like, okay, when I proceeded with my scan and everything. So many girls don't even know they have this syndrome, but it is already showing. It is already giving them sign and symptoms, but they don't even know.
You're not paying
They are
attention
not
to
paying
it.
attention. So there are a lot of signs that can actually show that you are going through these hormonal issues, but because you are not paying attention, you feel like you are doing well. Just like you having painful, extra painful. I call it extra because your period, of course, can be painful. But when it becomes more painful than the usual, then you should know that there is an issue going on in your body. You can have extra painful periods. You can have mixed period. You can have irregular period. Sometimes you see some ladies that will tell you, I see my period about 2 to 3 times in a month. Then there is an issue. Don't feel like, oh, maybe I have a lot of blood, or because I took one blood tonic, then I have blood in my system. No, it is very, very abnormal. You are experiencing hormonal imbalance. And let me say something, hormonal imbalance does not mean you have PCOS. There is hormonal imbalance and there is also PCOS.
Okay, can you shed more light on the hormonal imbalance and the PCOS? How can we differentiate the both?
Hormonal imbalance is actually their general name. Yes, just like we have A, B, C, D, we call them alphabets. We have one, two, three, we call them numbers. Hormonal imbalance is the general name. So in hormonal imbalance, we have PCOS, we have high prolactin, that is lactating, like you are not pregnant and then breast milk is coming out from your breast. We have mixed period. You might mix your period and not even have PCOS. It might just be as a result of hormonal imbalance. So hormonal imbalance is more like their general name. So inside of hormonal imbalance, that's where PCOS is like being brought out from. So your hormone has to be imbalanced before you have PCOS.
So personally, what was the first thing you noticed that made you understand maybe you have PCOS or something?
Actually, like I said, I was very like inquisitive. I was ready to know much about this. Now I came across it on TikTok. I was seeing people talk about PCOS, and I just said, okay, let me read more on it. And then after studying, I realized that wait, my painful, extra painful menstrual cycle is not ordinary. It means it is very, very possible that I do have PCOS. So I don't just want to jump to the conclusion that, oh, because I have extra painful period, that means I have PCOS.
PCOS.
Like I said, extra painful period can also be as a result of just normal hormonal imbalance. You might never have PCOS, you might not have high prolactin, you might not have any other disorder in your body, but it might just be that a particular hormone in your body is not balanced. So I went for I visited a gynecologist. That's I used to talk to him one time just for normal health benefits. So I spoke to him and then he was like, "Have you heard of PCOS?" I'm like, "Yes, sir." So he told me we have to do some scan to
Okay.
confirm because I can't just start taking medications without not like knowing the
What you're
roots.
taking.
It might not be PCOS, it can be other issues. So I actually did the TVS transvaginal scan, I did the pelvic scan, and then from what the radiographer said, he said he saw some follicles on the ovaries,
Mm.
and even with some follicles on the ovaries, truthfully, you might not have PCOS. So later, I was so interested to know more because the results came out. So you are suggestive to have PCOS. So for them to say suggestive, it means they are
Very
not
sure.
even sure. So at least more law school, I'm a graduate of hospitality and tourism management. So I have the understanding that when they use the word suggestive, that's they suggest, they are not so sure. So I actually went like back to my gynecologist and then he said, okay, I should try to do the hormonal profile test. So after carrying out the hormonal profile test, it said I have PCOS. So it was from there I started the journey, the lifestyle, and then God is helping. Sha.
Okay, I think the first time I heard about PCOS, I was so scared because everybody was like, "Oh, if you have I read comments and people were like, "Oh, if you have PCOS, you won't be able to give birth. The fear is there. Oh, PCOS means you cannot give birth. PCOS means infertility and all." How did your diagnosis affect you emotionally, mentally, and physically?
Hmm. The fear of every woman is them knowing that I am or they are infertile.
Mm.
But of course, for every young girl at the age of I actually found out when I was 22. So I was scared that wait, does
Mm.
that mean if they say PCOS, infertility, does that mean I won't be able to give birth? I was actually scared. And truth be told, it affected me. Like
Mm.
apart from me having the knowledge before I was even diagnosed of it, I was really, really scared. I became very far from people. It affected me mentally, emotionally. There are days that I'll be in my room alone, I will just be crying. There are days that I'll be in my room alone, I'll be on my phone, I will like try to
Researching.
research, study, just know much that am I going to give birth? Oh, I will have to, sometimes I will even type, will I be able to give birth with PCS? And I saw different people, different testifiers that
Mm.
yes, they were able. In fact, let me shock you. You have the high tendency of having twins, triplets, and even quadruplets with PCOS. Yes, that's because you see your egg that is not fertilized or the premature eggs that you have on your ovaries. Those are called the follicles. You see, when they are in large numbers, probably you have like about 16 follicles on your right ovary, you have 16 follicles on your left ovary. That's not normal. But by the time they start getting mature, four can get matured at the same time. So now imagine four egg gets matured and then you had maybe sexual intercourse and the sperm touches the whole four. Just be ready to carry four babies. Yes, that's how people with PCOS, that's how lucky they are when it comes to carrying their own baby. They
Mm.
have like very high tendency of having twins, triplets, because three egg can mature at the same time. And the normal one is just for one egg to mature and to rupture. So if at all your egg matures like about three of them, you're expecting triplets, it can affect a lot if you don't have the understanding. So it is always good that when doctor tells you this is what you have, try to research, know much, because even depression, by the time you allow depression, frustration to set in, it can even worsen your situation. At that point, you don't need to be depressed, you don't need to be frustrated, you don't need to see yourself less. All you need is work on yourself, work on your lifestyle, read more about it, know what the type of food for like you can eat,
Mm.
know the type of fruits you need to take. You don't just at that point you can't take anything. You of course you're not different from every other ladies out there. The only difference is that you are just going to watch everything that goes inside your body, your inside body. So that's just it. With the help of you knowing more about it, you will be fine. Trust me.
Okay, so I think there was a time I read about PCOS, and a lady was sharing that there are signs that you know you have PCOS. For instance, excessive weight gain, having hairs all over your body, and some other things. So, what are the common misconceptions people have about PCOS? Is it possible that for the fact that somebody is growing hair, for instance, you are growing beard, because I think I have it. For the fact that you are growing beard, does that
Okay.
mean you have PCOS, or it's just the hormonal balance itself?
Okay. We all know that. So the issue of beard, we all know that. Like she said, beard, the beards issue. We all know that it is abnormal for a lady to grow beards. But if a lady is growing beards, does not mean does it still doesn't confirm that she has PCOS. It can just be as a result of probably probably the I think the man's hormone in her body, it might be more, which is not normal. That can be under maybe what's it called, hormonal imbalance. Although growing beards is also part of the signs and symptoms for PCOS. Yes, there are a lot. Body weight. People will be like, you know that I saw you last 2 years. You were not this big. And then I was just like, well, don't worry, I'm sure living fine. I eat 3 square meal. I'm happy. If I want to buy anything, I can buy it. Because how many people do I want to explain to that this is what I am going through? So many people don't know. So you just notice the sudden weight gain, and you notice the irregular period. You notice not everyone even has hair, but trust me, if you have beards, if you start noticing some kind of visible hair coming out from your chin, you need to visit the doctor. You need to visit the gynecologist, because it can be something must have triggered it. Because of course you don't used to have hair there, and then out of the blues you started growing beards. Then you should know that something is wrong. God did not create we ladies
To grow
to
beard.
grow beards at all. It is, we know it is common amongst men. When you see even animals, you see goats, you will not see a female goat growing beard. Yeah, you will see only male goats growing beards. So when you see your fellow female growing beards, it is not always good to body shame. In fact, I have seen people that be like, this girl, better wash your stomach. See, your stomach is big. It is not my fault. Funny thing is, I might not have even eaten for that day, but PCOS belly. Me, I'm even still okay compared to some persons. You will see their belly and you be like, is there a baby inside? And there is no baby, but it is due to the effect of PCOS. This is due to the effect of PCOS. So you growing beards might not necessarily mean it is actually PCOS. Do you understand? But PCOS symptom is also growing hair. Or in fact, let me now shock you. There are some persons that are actually very, very hairy. That you female that are very hairy, that you see them growing hair here. At least we all know that it is mostly common among guys to have hair here all over this place. But when you see a lady growing hair, it might even just be as a result of maybe genetics, maybe probably my godmother is hairy, my great grandmother is hairy, and it might not even be hormonal imbalance, it might not be PCOS, it might not be hyperlactin. But by the time you start noticing hair let me use the word uncommon places, you start noticing hair on your chest, what you don't usually have. You start noticing acne. Oh, see, I'm still battling with acne. I have spent money, I have spent time, I have tried different products. So later I got to realize that, oh, so this thing is also part hormonal acne. Once you start noticing acne under your chin, once you start noticing acne in here, just know that go and seek doctor. The normal people that have pimples, they will have pimples, you see them have pimples here. Once you start noticing that your pimple or your acne,
When you were talking, you mentioned the fact that you did not discover early that you have PCOS. So what are the early signs? Because I believe that there are a lot of girls out there that they don't even know they have PCOS. So what are the early signs to notice? And I understand the fact that our hormones differs. The
yeah,
signs I might be having if I have PCOS
yeah,
is might be quite different from yours.
yeah.
So what are the early signs and warnings for young girls to take note of?
Okay. Like she said, we have our hormone actually differs. What I might be going through PCOS, she might be going through PCOS, and then our symptoms are very, very much different. You see this PCOS, now known as PMOS. I think we are used to calling it PCOS because that's what we have always known it to be. So it just changed last month. So PMOS, it actually has different types. We have the is insulin resistant. We have the sorry. We have the adrenal PCOS. We have the inflammatory PCOS. We have the post pill PCOS. Sometimes it can be as a result of I'm trying to prevent pregnancy that can cause you PCOS. Probably the drug you used has actually like triggered a particular hormone in your body. The hormone system, we have the estrogen, we have the progesterone. The drug can actually affect your progesterone level or it affects your estrogen level. That's when you start seeing, oh, I have PCOS, I have PCOS. Me personally, during my research, and I was able to like merge my symptoms and my research together. I noticed, oh, I think mine is insulin resistant because insulin resistance as a result of high sugar intake. My body was fighting. I don't have diabetes, but you see, when it comes to insulin resistance, it means you are actually close to having diabetes. Like not diabetes of the blood. You know, there's diabetes of the blood. There's one for fluid in the human body. So my fluid is, in fact, when you say sugar, me myself, I know that yes, I personally drag problem for myself. God forbid, it's no longer a problem. It's now something that I can talk to. Yes, I am conscious of, and I can actually educate my gender on. So I battled with insulin resistance for long. There was a point in my life that I craved sugar. Like there is level to this thing. You know, see, the moment you start realizing that you cannot do without taking sugar, just know that there is something going on in your body. The moment you start you start getting addicted, they say addiction is not good. Truly, even to sugar, addiction is not good. By the time you start getting addicted to sugar, just know that there is something that is getting itself destroyed in your hormones, in your body. So at that point, I noticed I was craving what's this? I was craving icing sugar. See, they should not celebrate birthday or anything as long as I have seen cake. I will tell you I don't want cake. I want icing. Just pack all the icing. I was proud of myself. Oh, I can take sugar, I can take icing sugar, and there is nothing. I don't have jelly, I don't have back pain. But it was really affecting a lot. It's really affected a lot in my body. So when I got to know my own type of PCOS that I have, I started cutting down sugar. My favorite food is rice. My friend, she'll still tell you that, you see Adura, she can eat rice Monday to Sunday, morning, afternoon, and night. Morning, afternoon, and night. For 7 days, I can eat rice. And as we all know, rice is carbohydrates. And the end product of carbohydrate, or the end point of carbohydrate, is glucose, is sugar. Let's not lie to each other. So as somebody who has diagnosed PCOS, and you're any type of PCOS you have, probably insulin resistant, just know that you should cut carbohydrates totally.